Hi everyone, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's talk about how to relieve sensitivity after a filling. Getting a dental filling is usually a routine procedure that dentists perform day after day. So why is it that some patients experience sensitivity after a filling? Let's step back for a minute and discuss how and why that could be happening. But before we jump in, I'd like to remind you about my website, teethtalkgirl.com. If you're ever looking to learn more about a specific dental topic, I have a search bar where you can easily find what you're looking for, and my Instagram at teethtalkgirl. A tooth filling is a small, sometimes large restoration made out of really durable material that your dentist uses to fill in and patch over a hole in your tooth. The hole, in this case, is a cavity. At first, the entire area of decay has to be cleaned out before you can place the dental filling in. So this includes removing the closest layer of enamel or dentin next to the cavity. That way, your filling is placed flush up against healthy tooth structure. Now, every tooth has its own set of nerves. Just like other places in your body, irritation or trauma to those nerves can cause sensitivity or pain. Fortunately, in the case of dental fillings, that discomfort is usually temporary. A few of the most common reasons to feel that after tooth filling pain include soreness from where the local anesthetic was injected, the filling being in close proximity to your tooth nerve, getting a larger than normal filling, temperature changes, the filling being too high on your tooth, causing pressure on the tooth when biting or chewing, and or accidentally biting down hard on your tissue when you were still numb. More often than not, after you get a filling, the nerve inside of it is in shock for a little bit. It can take as long as several weeks for the nerve to adjust to its new structure. In the meantime, some mild to moderate sensitivity is completely normal. However, if the filling was extremely large and your tooth keeps hurting, there's a chance that the nerve was too close to the cavity. In this situation, your dentist would have already given you a heads up beforehand, prior to placing your filling, and they would have explained to you to call if you're feeling pain after a given amount of time. But in general, like I said, for most straightforward fillings, the good news is that your tenderness will normally wear off on its own. It can take up to 4 to 6 weeks for your nerve to completely settle down, but rule of thumb is usually if it doesn't start to improve gradually within a couple weeks, 10 to 14 days, you should call your dental office to have it evaluated. They may need to simply adjust the occlusion, which is your biting surface of your filling. If your filling is too high and it's biting down before the other teeth in your mouth, that extra pressure can cause tooth pain. This sometimes happens because when you are testing the bite at your filling appointment, you are numb, which makes it hard to tell if you're biting down correctly. But again, in most cases, you won't even have to do that. Sensitivity after getting a filling is temporary and goes away on its own within a few days. Time is usually the best treatment. Now, is there anything you can do to prevent sensitivity after a filling? Sure there is. Try to avoid eating on that side of your mouth until the numbness completely wears off. Then you won't accidentally bite your cheek, lip, or tongue because of your mouth being numb. Also, it's a good idea to skip whitening your teeth for a while. And if you want to be very proactive, you can use a sensitivity toothpaste. It can't hurt, it can only help. And lastly, here are a few red flags that might cue you in that it is not normal sensitivity and something else might be going on. Although again, I say these with great discretion, please do not panic if you are noticing one of these symptoms. Only be aware so you can tell your dentist at your next appointment. Spontaneous pain or tenderness, especially when laying down in bed. Dull aches when eating or drinking something hot. Off and on twinges that seem to pop up for no reason. Sore gums next to your tooth. Lingering soreness after meals, clenching, or when you wake up. Like I keep saying, if you are concerned at all, especially if symptoms last longer than 10 to 14 days, it is always recommended to call your dental office for an exam. If you want to learn more about generalized sensitivity, meaning you have sensitive teeth always, not just after a filling, I'll link my sensitivity relief video in the bottom bar below. I hope this video helped you. Please like and subscribe if it did, and until next time, peace, love, and teeth.